It's scary. Okay, so I was just calling the attention of Dr. Bat. I said I be want know where we dey for table because I know as of last week we're night, and it's like every day now we dey come. I don't know. It's not a good news, anyways, that we are topping the chart. We are beginning to top the chart because right now we are sixth in Africa in terms of numbers, and of course, in number of numbers of people who don't dey infected with the virus. Ladies and gentlemen, I'm not smiling, I'm not happy because I still dey ask myself, wetin dey wey we never do, or wetin be those things wey we know they do, wey we suppose they do. Hopefully, we'll hear more of that from Dr. Bat this morning. Still here talking about the pandemic, talking about coronavirus. Of course, talking about everything you guys need to know about wetin dey shele for the world right about now. And I'll get Dr. Bat in the building, obviously. I know he's also not smiling because we are not happy about the fact that the numbers are increasing.
It calls for a sober reflection.
Yeah, it is, Doctor.
Slimmest of them all. Good morning.
Good morning, Doctor.
Yes, it's on that note that I want to say a very big thank you to all our numerous viewers and our home and around the world. We are back today on Health Matter. Yes, we are not happy with the numbers that are spiking up, with the figures that we are getting. Just 2 days ago, Nigeria recorded what today stands to be the highest tally, the highest daily tally we have seen since the pandemic began. 1,964 people were infected in just one single day in Nigeria. That was the highest we have seen. Suffice also to point out that we are just talking about reported cases. What about the other people who may have been infected but were not able to be counted within these figures that we are talking about? On a global scale too, the figures are not anything friendly. At the moment, over 98 million people have been infected globally. 98,750,103 persons have been infected globally. My source is worldometer.com. And of course, unfortunately too, more than 2 million people have lost their lives to COVID-19 pandemic. 2,116,438 persons have died. This is not a joke. Over 70 million individuals have equally recovered from this COVID-19 contagion or disease. And this morning, we'll be looking at the improvements that we've been able to make at the global level as well as at the national level, talking about Nigeria. We started by talking about the figures that we saw in Nigeria in the last 48 hours. Also in the last 24 hours, Nigeria recorded 1,483 new cases. As of 17th of January was actually when we crossed the green milestone of 100,000 cases. And about that time, 1,400 persons in Nigeria have lost their lives. Between that 17th till today, which should be about 6 days, 90 people have died as a result of this COVID-19. Yes, not up to a week. It was 1,400 as of 17th, and today we are looking at 1,490 persons, and we are talking about documented people that were counted. What about the many others who may not have known what killed them? And that is why today we'll be looking at updates that we have with respect to vaccines as well as diagnostics. Just about some few days ago, the NCDC published the guideline for rapid diagnostic testing method in Nigeria. For me, as a medical practitioner, I can tell you that that appears to be a game changer in our management of COVID-19. Why did I say so? It will afford a number of organizations, hospitals, be it privately owned or government owned, schools, churches, and a number of other places where you have large gathering of people, especially students that are in boarding school. So they will now have an avenue where they can do mass testing probably for all the students or for people who are coming into the hospital, you have the capacity to do mass testing for this group of people and get the result. The turnaround time is said to be between 10 to 30 minutes. Okay? We are talking about point of the care testing. You come into a hospital. Before now, what we're told to do as medical practitioners is to have a higher, at a point it was high index of suspicion, but we are told to have a higher index of suspicion. And I can tell you that that cannot be enough. Just having a high index of suspicion to be able to do triage and separate patients. Keep in mind that a number of people that you may come in contact with may be asymptomatic. Some few months back, we talked about symptomatic carriers, pre-symptomatic carriers, and symptomatic carriers. Now, symptomatic carriers are people who are presenting with symptoms. Of course, we know the symptoms that they could present with, okay, among which are high fever, cough, loss of sense of taste and smell, recent history of loss of sense of smell and taste, okay, difficulty in breathing in some situations. These are common symptoms that we see, okay. This group of people are called symptomatic carriers, people who present with these symptoms. And of course, you have the pre-symptomatic carriers, people who may present with symptoms much later, some few days afterwards. And then you have the third group, which is the asymptomatic carriers, people who may have the disease and may not be presenting with any symptoms. So with the validation of rapid test kits that we have in Nigeria, as a matter of fact, we have 2 of them. Okay. Now, what happened was that sometime in September, the WHO actually gave an emergency use authorization, EUA, for 2 antigen-based rapid diagnostic test kits. And of course, they were from SD Biosensor as well as Abbott Laboratories in the US. Okay. Now, these 2 rapid diagnostic test kits were found to have at least minimal acceptable standard in terms of their ability to actually detect the disease, the antigen. I'll read out what I have here shortly concerning those test kits, okay? The available WHO data on both RDTs show that they meet the following minimal standards. Number 1, ability to correctly identify individuals with the disease, sensitivity, more than 80%. Number 2, ability to accurately identify those who do not have the disease, specificity. And of course, you have that at more than 97%. So these 2 test kits that WHO has given emergency use authorization, which of course our own NCDC, alongside other major health stakeholders, have validated and approved for use in Nigeria. They can actually detect people who do not have the disease, up to about 97%. And of course, they can detect people who have it up to more than 80%. And that, to me, is good enough. Okay? So that means that 20% may still be missed using this method of testing. And that was why they published the algorithm, okay, so that there are patterns and procedures that need to be followed, so that in situations where you still feel that the person may have some set of symptoms, you may still need to resort to the gold standard of doing the diagnosis for COVID-19, which of course is the molecular testing method. Talking about the polymerase chain reaction, PCR testing method is still the gold standard. So in some situations, people who have been tested with this but may have suspicious symptoms, okay, may still have to go forward and be sent for PCR testing to actually confirm if they have it or not. And I can tell you that with this, we are going to say bye-bye to a time when patients were being turned back from the hospitals on account of the fact that they were suspected to have COVID. Remember, early on in the pandemic, hospitals who were not accredited, as a matter of fact, government agencies were relentlessly warning hospitals,
All the numbers.
yes, not to get involved
Yeah.
in the treatment of COVID-19. And of course, at that time, a lot of private institutions, private hospitals, healthcare centers were helpless, more or less, because there was no way anybody can actually decipher who has it by just looking at the person's face or who does not have it. In terms of the symptoms, it's actually still very difficult to differentiate, because these symptoms that we mentioned a while ago are symptoms that you could have with the common disease entities we have in this environment. Typhoid will present with almost everything. Asthma, yes, we present with difficulty in breathing. So it was a Herculean task at that time, trying to identify who has it and who does not have it. And of course, as a result of that, a whole lot of healthcare workers were getting infected left, right, and center because they were helpless. But that is not going to happen anymore with the advent of rapid diagnostic test kits. So you will now have an opportunity of doing a triage at the entrance of the hospital, map out a place where people will be tested regardless. The ones that are presenting with symptoms, the ones that may be going for surgery, for elective cases, they can now be screened and, of course, get the result within 10 to 30 minutes.
That's a good one.
So that from that point, you know who to ask to self-isolate or to make sure the person gets into isolation zone and not come in contact. And of course, you'll be able to advise the person accordingly so that the person will take the necessary precautions not to infect the family members at home. So for me, this is a big leap, okay, for our fight against COVID-19 in the country. And my prayer and earnest expectation is that it can be made available to get to all the institutions that may have one form of need or the other for it. So first also to point out that as we speak, Nigeria now has more than 112 molecular laboratories scattered across the country. And 74 of them are government-owned centers. Okay? In these centers, you can actually walk in. If you fall within the stipulated case definition guidelines, you can walk in if you're presenting with symptoms. But there is a pattern. You don't just walk into those places. You need to go online and then book an appointment with them before you can come in. You'll be asked to come in and be screened for free. You're not going to pay any money, okay? Beyond the 74 thereabout that we have almost or about 38 privately owned ones that one can actually go. Yes, I want to travel. I want to have an idea of my status. You can go in there and pay some amount of money, of course, to be tested with PCR. And of course, we know that government has paid the price for testing with PCR for about 50,400 or thereabout. And I'm hoping that with the new rapid diagnostic test kits that are available, that will bring down the cost of testing for COVID-19. And of course, it will encourage more people to come up to present themselves and get tested. Because I can tell you that a problem identified is a problem half solved. Okay? So
and
globally,
Doctor, I think people are also coming out now, unlike how it used to be. Or let me say people are getting to believe, because now they blur their faces, but at least for Lagos State government, I know now they go to hospitals and then they do a day in their isolation center, where they get to interview people that have been infected with the virus and all of that. So some I think we're waking up.
Yeah. Talking about stigma, I think it was at the beginning there was a lot of stigma with respect to people who have COVID, but not anymore. Who are you going to stigmatize against? Because almost yes. I could remember some few months ago, people will call in and be asking us, have you seen somebody infected with COVID? I'm not sure any Nigerian will still want to ask such a question at this stage, because people who have been infected are everywhere. They are around us. Okay, so there is nobody that can still be claiming at this point in time that haven't seen anybody that is infected. In other words, we don't think there could still be people out there. There may be a handful.
There are still some, Dr. Bat. There are still some that still find it very difficult to believe. The best I can do is to smile, because, yes, I understand if I say this now, everything they affect the entire world. But as an individual, I ask myself, Stimi, are you doing enough? Do you think you're doing enough to stay safe? To secure yourself and, of course, every other person with around you. Because the truth is, you can't give what you don't have. If you try protect yourself, there is no way you can tell others to protect themselves. So it starts with you where they watch the show this morning. It starts with me, where sit down here, where they follow you talk. Obviously, Dr. Bad, they carry last when it comes to the measures taken and all of that. But anyways, we open our phone line straight up, just in case they watch us from any part of the world this morning. That now why be pandemic, because not be just Africa alone they affect. It's affecting the entire world. Even the president now, Joe Biden, now like immediately enter one of the things where be talk, why I see, why I hear. Now say you can't even enter US right about now without presenting your test results. Say we got see, we have to know you are negative, we have to know you are safe, so that you know will come again, can they affect or infect people way down there inside America. So if you have questions, please feel free to call those numbers with it on your screen. 08105434985 and of course 081731475. Now the truth is, Dr. Bat, I'll give answer to the government, because for me, I feel they are doing enough. You know, they come out like every day to give us facts and figures, give us updates. You know, the presidential task force, they are the ones in charge.
Yes.
They've been giving us updates from the beginning of this whole drama. Even the governor of Lagos State is always coming out to tell us, okay, how far. The other day, I was opportune to join his live broadcast when he mentioned that between the space of December 1st and to 30th of December, the numbers they recorded in Lagos, and he was asking himself, like, really, what was responsible? What happened? What was responsible for the spike? And now he said between now and February, on a norm, they used like 70 downwards, you know, in terms of cylinder. But right now, in a day now, they use like almost 400 oxygen cylinders, and it is really, really sad, because I really do not know what we need to do again that we are not doing. And right now, it's like we are just going to hand everything to God.
No.
Yes,
we have to, but we need to do ours. What we need to do as humans, not just depending on God. One cannot afford to climb onto a tree and then you let go of your hands. Of course, you will fall and have a good fall. Okay, so it all boils down to each and every one of us taking responsibility. We need to take responsibility. Of course, we know the second wave is here with us. I think it was last week, a fortnight ago, that someone was asking us, what can we say with the major reasons why the second wave is sweeping across Nigeria? Okay, and of course, we attempted to answer that question by saying one of the things we feel may have contributed is the fact that at a point we got tired. We became weary. The race was becoming more of a marathon. And of course, people became tired of taking or adhering strictly to those public health measures that we've always been told about. Of course, essentially to wear our mask, face masks at all times when we are in the public spaces, as well as wash our hands, frequent washing of hands under running water with soap. Where that is not possible, where it's impracticable, you have to make use of your hand rub or hand sanitizers and maintain social distancing as much as possible. Avoid gathering. Another reason, apart from poor compliance or non-compliance of public health measures of COVID-19 prevention, another major reason why we have the second wave with us is the fact that we now have a number of variants. Notable among the variants that we have. But before I go to the variants, so the specific variants that we have that the world are concerned about, I want to talk about mutations generally. Okay, we saw the NCDC Director General in one of the video clips that we watched a while ago explaining what those variants and mutations were all about. It is a normal thing for viruses to mutate, for them to change color, wear another cap today, different from what they were putting on the day before. We tried to explain that last week. So it is a natural thing for viruses to mutate, okay? But sometimes some of the mutants, some of the variants may not pose any significant danger to already or the pre-existing or the pre-circulating ones. Some will fizzle out along the line. But sometimes some of them will become a lot more deadlier. And of course, that is what we are seeing currently. And the worry and the concern is this. Yes, we have vaccines. A lot of people are beginning to get it. I think in the US, there are almost about more than 19 million persons have been vaccinated in the US. Okay? Now, but apart from this, the fact that these people are getting vaccinated, with these new variants that are coming into the picture, are we sure the currently available vaccines
Vaccine can even work,
can protect people from these
That's
new
true.
variants? Our own Professor Tomori said a while ago that what the vaccine will do for you is to prevent infection from becoming a disease. Okay, so what that means is that, yes, you may get infected, but you're not going to end up with a disease that may come out with a very bad outcome. Okay, so that is why even people who get vaccinated will still need to adhere strictly to those public health measures that we have been told about. Now, talking about the variants, notable among the variants of concerns at the moment is the B117, the one that is found in the UK and a number of other countries of the world. At the moment, 60% of all the COVID-19 viruses in the UK are actually made of this UK variant, the B117. And of course, there was another one that emanated from South Africa, B1351. That South African variant, too, is said to be deadly. We are not so sure.
Doctor, do we have?
Yes. A variant was discovered in Nigeria, but NCDC, along other authorities and stakeholders, are still working to actually carry out more genomic sequencing and actually categorize it. Now, we are worried because we are thinking these new variants, they've been found to be a lot more contagious without a doubt, but are they likely to be deadlier than the ones that were previously circulating? With the vaccines we currently have, be able to capture them, be able to still be as good and as effective as we were told at the initial stage. And of course, there was another one too that emanated from Brazil, the P1 variant. Okay. In Brazil, it's a very solid situation that they are having in Brazil at the moment. Their healthcare system is overwhelmed. Overwhelmed. Okay. Much more than what you have in the US. So everybody is worried with the emergence of these new variants. Everybody is worried with the emergence of this new variant. Are they going to be a lot more deadlier? The pathogenicity of them, is it going to be like what we are used to before? Apart from that, the currently available diagnostic testing methods, will they be able to capture these new variants? So a lot of unanswered questions. So that is why the scientific community are troubled with what is going on. And I tell you, it's better to stay protected. Prevention is always better than cure. Okay, so that's why we need to take responsibility as individuals. Now, let's look at the tally that we have at the moment in South Africa. Some time ago, I was looking at the figures and I asked myself, where is China? Where it all started in all of this? Nigeria has gone past China by far.
But then, how were they able to curb theirs, doctor? Seriously, maybe we should just ask them. Like you said, it started from them. And now they're still on the charts, right?
In terms of the number of people that have been affected, not in terms of fatalities anyway, okay? Nigeria has gone over and above China. And of course, like you said, what is China doing that other nations of the world are not doing? I can tell you that in China today, if you're caught without face mask, you face the music. That is one of the things they are doing. Their government have put their legs down to ensure that citizens comply with all the public health measures to the fullest. No short measure, no halfway.
They are obeying laws.
And of course, the type of lockdown we saw in China, we never witnessed it or experienced it in any other part of the world. At Wuhan City, Hubei province, at a point they were locked for more than 3 months, and people were obeying. Well, in this part of the world, with all the things we are singing and crying and shouting, you still see people telling you that there is nothing like COVID. They don't wear no face mask. They don't wash their hands.
But then, doctor, it's not like we don't have. I think for me, at the end of the day, because the government is already saying is that if we keep failing to obey all of the measures that they've put on ground, we might not escape the second lockdown. Because the truth is, it's not like we don't have this, this set of people also in China. Do you understand? I'm sure we have people with the same mindset there too. But then because they made it a law
Their system does
Their
not
system does
give
not
room.
allow for
Yes.
You, whether you believe or not.
For misbehavior.
Or for you to misbehave, because you know there are penalties. So until we start making a scapegoat, doctor, I feel, and that is why some states, I think I actually said it on the morning show, now some states have actually said without the mask you cannot even go into public places. Like, you have to just, it's either you stay at home, and if you want to go out, if indeed you need to go out, you have to have your mask on. So until we start doing that, I don't know, maybe we'll just keep saying the same thing, we'll keep repeating ourselves.
Yeah, you were talking about the interview that was granted by the Honorable Commissioner of Health for Lagos State, Professor Ake Abayomi, I think about a fortnight ago or thereabout, where he said that on daily basis they use over 300 big oxygen cylinders at the IDH, Isolation Center in Lagos. So you can imagine what the oxygen is even in short supply, it's scarce at the moment. Okay, now people are getting infected on daily basis, without a doubt. Okay, I can tell you that they're everywhere. Time was when government was hell-bent on chasing hospitals, don't do this, don't do that.
But
not anymore.
now,
Nobody has anybody's time. It has gotten out of hand. That is the truth. In the last 2 months, I saw more than 5 cases of COVID. They're everywhere. So you just need to stay protected. You just need to protect yourself. On African log, this is what we have here. South Africa is still on number 1 with over 1.3 million confirmed cases of COVID-19. And in the last 24 hours, 11,761 individuals were newly infected.
Okay.
That's in South Africa. And of course, in the last 24 hours, 575 persons died. So when you're hearing, when people are dying in hundreds, you can say that a lot of us before now said, oh no, you cannot touch Africans. We are this, we are that. We have found out that all of that are not as we previously thought. Yes, granted that we are not as badly hit as some other nations of the world. We have tried to, a number of our school of thought, scientific community, scientists have actually tried to advance one reason or the other, or narrative that this could be as a result of this, this could be as a result of that. But this second wave is beginning to defy all of that. Okay? Morocco is on the second in terms of caseload with 464,844 confirmed cases. And in the last 24 hours, they saw 1,138 newly infected individuals. And of course, 29 people died in that country. Tunisia comes second. With 193,273 persons infected. And of course, Nigeria, that some 2 weeks ago was seated at about the 9th position, has come up to 6th position. Currently, the caseload that we have seen in Nigeria stands at 118,138 persons have been confirmed in Nigeria to have COVID-19. And of course, this includes the number of people that have survived, okay, as well as the number of people that unfortunately did not make it. And in the last 24 hours, Nigeria saw 1,483 cases, okay, persons
so every day
that
now
were
is always
infected.
1,000 plus.
So in the last, I think, from the beginning of January, we can count the number of days that we didn't have cases rising above 1,000. And of course, we are beginning to near 2,000. And I can tell you, with the emergence of the rapid antigen rapid diagnostic test kit, RDTs, the number of tests, our testing capacity is obviously going to come up. Okay, so we might be seeing a situation where we'll be counting in thousands, much more than we are currently doing. Okay, so at the moment, in terms of the number of people that have been tested in Nigeria, or the number of tests that have been carried out in Nigeria, Nigeria has tested about 1.2 million, 1,225,179. So Nigeria has done over 1.2 million tests since the pandemic began. Okay, and like I said at the beginning of the show, at the moment we have over 112 labs that have the capacity to independently test for COVID-19, and 78 of them are government-owned labs. About 38 are privately owned, where you can walk in and be tested for a fee. But the government-owned labs, once you fit into the criteria to be tested, you need to either you book online or you call your state hotlines. And of course, they will give you, instructions will be provided for you on how to go about it.
Hey, okay, Chuku. Okay. Okay, Chuku. Good morning.
Yes.
Okay, can you turn down your volume? Please go on.
I have a question.
Yeah, go on.
Go ahead.
Yes. Good morning.
Good morning.
Good morning, Okechukwu.
I have a question.
All right, let's hear it.
Yes. My question is, we heard, I actually live in Switzerland.
Okay.
And I'm here on holiday. And we know about the Madagascar COVID-19 solution. And I personally, in Switzerland, I was sick. I had all the symptoms in April, March last year. Okay? And
Please go on.
Okay. And I was able to cure myself with this some dogoyaro that I had, together with garlic, with some other herbs that was prescribed, that I heard that could do such things. Okay, and then I was adding some what do you call it, aboniki to it, and then I steamed it. After 2-3 days steaming, it disappeared. Not completely, but it was like almost completely disappeared. I was simply coughing a little every once in a while, maybe coughing like 10 times or 8 times a day. You know? So now, if we have all these medications out here, because when I come to Nigeria and I drive through the forest on the express road, I see so many of these trees. I wonder why it is cheaper for us to politicize this than to use our herbal medical system and heal our people. I'm really baffled about all this because I see it as being politicized.
Okay. Doctor, what do you have to say?
I think it's easier to encourage the people to steam with the Lapuku and
okay. We don't need to call any brand. Okay, you don't need to call any brand. I think you've said enough for us to understand where you're coming from. So we'll just allow the doctor to, respond to all of the things you've said.
Thank you very much. I think it was Fidel Castro that once said that in a period of crisis to be law-abiding. I'm not sure if it was him, but I've heard that before countless number of times from a number of people, that in a worst situation, in a crisis situation, to be law-abiding is illegal. Now, I want to just paint a picture of that in what is going on in COVID-19 pandemic. Because it has been said that there is no known cure, people are more or less at liberty to try all sorts.
Yeah.
To try all sorts. And that is actually what we're having on our hands today. And one of those video clips that came from NCDC, okay, what they actually say, what they are saying is that there is no scientific evidence that these things work. Okay, I won't be surprised
if it works.
No, I won't be surprised if in the near future one of these is some of these may be discovered to be actually effective. Okay, but the truth of the matter is that, be that as it may, deep inside of us, even those of us who are medical doctors, we do know that our people are using our local herbs to fight this disease. I have a friend that was infected in the last 2 weeks. Okay, the guy, of course, I was in touch. I was constantly in touch with him, guiding him. He was self-isolating at home, and then doing the few things we could ask him to do, checking his SpO2, monitoring his oxygen level and all that. He confided in me because sometimes when I speak with him on phone, I could hear him. He could cough in 1 minute for repeated number of times, sometimes 10, and then the speech would answer. It was symptomatic, without a doubt. Okay, but he was doing all of this. He was doing steam inhalation. He was doing all whatnot. And he said after doing it, he usually gets some degree of relief. And today he has tested negative. Okay, so now if you ask me, what could have helped him?
Responsible.
Yes. It's a question that will be very difficult. I must be honest with you. I can't conveniently say I have an answer to those questions. But he tried all of this. Okay? Okay, but what we are saying is, on a very scientific standpoint, these things have not been found to give the results that people claim. So what to do if you're caught up in that situation? Yes, there are a few drugs that have been approved for treatment of COVID. We know of remdesivir, we know of dexamethasone that are used in the treatment of severe cases of COVID. But we don't want individuals to resort to self-help.
Yeah, medication.
Okay? The government has categorized treatments that could go on at home. They've said that it's only mild to moderate cases that can be treated at home. But if you're presenting with symptoms and your SpO2 is within some certain range, you'll be advised to go to government treatment centers. And I can tell you that that should be the gold standard. But when people are left with no option, they will be trying all sorts. Because somebody who needs help...
But then you need to also be careful of what you're trying before you now make it more complicated.
Yes. Talking about vaccines, vaccine updates. We're expecting about 100,000...
Not in January anymore now, doctor. No, it's true now. They've told us it's no longer in January, till February. So we're anticipating.
Yes, with an expectant heart, we want to say.
You know.
Okay, so, but as it stands now, my source is the New York Times, coronavirus vaccine tracker. 40 vaccine candidates are currently in phase 1. 24 have gone up to phase 2, 20 are in phase 3. And of course, 8 of them have gotten limited approval. 2 only have gotten formal approval. And of course, 1 was abandoned. Talking about that particular vaccines that some of the volunteers that took it ended up testing positive to HIV, and yet they did not have HIV. That has been abandoned. Those are some of the challenges that could come with some of these trials. But we're happy today because as it stands, the hope of humanity lies on the emergence of those vaccines. And of course, we have Pfizer-BioNTech and Moderna candidates said to be the 2 most effective vaccines. But the challenge is the numbers may not be adequate, and we do not know in this part of the world when we will start having them. Okay? I think on that note, we'll be drawing the curtain today, and hopefully next week we can do more of vaccines and give a lot more updates. I'm sure Slimity will have some things to say.
Yeah, definitely, definitely. I hope I come here smiling next week. All right, we'll see you guys next week, Saturday by His Grace. Please stay tuned. Thank you so much for joining us on the show. My name is Limi, and of course, Dr. Bat.
Thank you very much.